So one of the things we wanted to give you was some tips on helping with soreness. Okay. So we've told you with pain, go see the physician. Uh, it's probably something a little more serious that needs dealt with. But our first key item is ice versus heat. So what do you do? What do you tell your clients and stuff like that?
Yeah, I think it's the number one question that I get between from people is when do I ice? When do I heat? Is ice good for this? Is heat good for that? Blah blah blah. And there's some general rules that you can kind of follow. So, ice at first 48 hours can't go wrong. Pain management is going to help with that and everything like that. Heat's going to be really good for soreness and managing some spasm if you got some light spasm or tightness, muscle tightness, things like that. There are some things that are coming out that say, no, ice after anything after 8 hours is, it's not good. It doesn't help the healing process, things like that. We'll kind of wait and see how the research kind of shakes out on that as it's coming out. But I would definitely say, a good rule is ice for your pain management. So if you're in a decent amount of soreness or pain or something like that, however you want to classify that, you can ice that. If you're going to try to get up and do some movement, heat beforehand. That's going to be the best way to handle that because that's going to loosen everything up and allow you to a little bit more motion, get that blood flowing, and get kind of some of that, inflammation out of the muscle.
I really agree with the idea of icing. My practice-based evidence from years of doing this and on athletics and with our general population, ice generally will help a lot with the pain and the soreness and the swelling.
Hmm.
So, especially I know there's a ton of high-profile athletes that swear by ice.
Yep.
Cryotherapy is huge, and you might hear it called cryotherapy. All they're talking about is some form of ice treatment. And I think that's one of the biggest things. And it's funny, people laugh when they're like, he's just going to say to ice it. But I'll tell you what, it makes people feel better because it does reduce that inflammatory response.
Oh, absolutely. And I would say about 20 to 30 minutes. That's what you're really looking for. If you're icing for 5, 10 minutes, you're not getting the response that your body needs to actually take care of that. So at least 20 minutes, 30 would be good. Then definitely make sure you have a barrier between the skin so you don't get frostbite because that's one that
Absolutely.
we got to talk about.
Absolutely.
Next one that I would say for a key one is sleep, and there's more research. I'm sure you probably half of our people are probably wearing fitness trackers that track their sleep. I definitely wear one,
Hmm.
um, and that's more research is coming out that sleep is one of the more important things for your recovery because it just helps. It's your body's way of naturally recovering, kind of shutting everything down, let your body rest and recover and do all that. So definitely you got to plan for a good night's sleep. Would you agree with kind of that thought process as it's coming here? I know it's difficult to get to sleep in America nowadays. Most people are thinking, 6 hours is good enough.
Absolutely. We're friends with a lot of our ex-athletes that are out there, and back when they were in college, getting 4 hours of sleep was acceptable and they could recover. But frankly, you get over that age of 25 into your 30s and so on, you really need that sleep, and it's restful sleep. I think
Yeah,
that's what
absolutely.
is. If you're waking up after 6 to 8 hours and you're still sore, you got to start to wonder, am I getting restful sleep? Um,
Hmm.
and I think that's one of the things we talked about. We could definitely do a bigger dive into that. If people were more interested, because I think that's one of the avenues you're going to see more often. Um,
Absolutely. There's a lot more coming out. There's a lot more products coming out. And there's actually a lot more. Another article that came out that people are kind of getting addicted to tracking their sleep, and it's actually making their sleep worse. So, yeah, that's a good one. It's always good to take it to the extreme on the other end.
yeah.
So yeah.
Well, people always ask me about stretching, when should I do it? I'm a big fan of stretching at the end of exercise and
Hmm.
before bed. You believe it or not, it tends to work a little bit better in reducing your soreness. Um,
Hmm.
all my post-operative patients, I would definitely tell that to, stretching before you go to bed, because then that way you're not going in with the muscles already tightened and then putting yourself in a very tightened position because nobody sleeps super stretched out. Uh,
No, absolutely not. Especially with the ankle, as we highlighted in our Achilles article, is the ankle is always in that pointed direction. So if you're having some lower body tightness or you want to avoid calf cramp in the middle of the night, definitely stretch that out a little bit, and that can, help loosen up your muscles. Last one I would look at is nutrition. And I think this is one that we would probably want to bring in a couple experts for some deeper dives, but just some basic advice that we would want to hand out is balanced diet, alcohol, avoid the alcohol after exercise. I know that's a big one for everybody. You finish the race and start chugging a beer. Maybe that might be good for one, but definitely cut it back a little bit. What else would you recommend with that?
Well, I'm a big believer of trying to, add some protein to the diet.
Hmm.
We're a big carb society, and protein is the muscle builder. No, you don't need to have tons of protein shakes or supplements and stuff like that, but adding adequate protein, some chicken, some red meat in moderation would be okay. Um,
Absolutely.
Even nuts and so forth would be as good as well. But
Yeah, good.
avoiding those fatty foods, that's going to be
Mhm.
huge.
Yeah, absolutely. Just because we say go find some protein, that doesn't mean you go over to McDonald's and slam a couple Big Macs and call it good.
Yep.
That's definitely not going to get the job done for what you're looking for.